My name is Peter Chin-Hong, Chin-Hong. I'm professor of medicine and infectious disease specialist at UCSF. Yes, I'm very concerned about a potential spike in cases in the community. However, if things go as we expect, and I'm crossing my fingers, the hospitals will remain quiet. And that's really what the power of the vaccines and the immunity force field is. Right now, cases in California are going up about 25% compared to the last 2 weeks. But on the other hand, hospitalizations are going down by about 25%. So we're seeing a decoupling of what's happening in the community with what's going on in the hospital. And I think all of that is driven really by a recent surge and by a high vaccination rate. Yes, definitely. Not only do we have fewer people getting really ill, but we also have many options to keep people away from the hospital, even if they weren't vaccinated or their immune status is poor. And these are things like Paxlovid, monoclonal antibodies, etc. So I think these gatherings are definitely going to drive up cases, particularly as people travel all around the country. Even though California so far is doing okay in terms of only a modest increase, when you look at DC, when you look at New York, Rhode Island, Puerto Rico, they're increasing cases by as much as 100, 150, 200%. So when people crisscross and move around, it's definitely going to bring infections all over the country. But some people may have a very low threshold for even getting infected, even though it's mild, because you will be sent at home for at least 5 days. You'll be taken out of the workforce. Students will be taken out of school. So in those settings, you may want to be extra careful. Even if you're vaccinated and boosted, you may still get breakthrough infection with these transmissible variants. And that infection will result in isolation. So that's the only rubric, even though you won't get relatively very ill. You'd expect to see that spike about 3 to 5 days after the people move around. So maybe you'll start beginning to see that next week. Yeah, so what we're continuing to see is very mild illness. And some of the common symptoms are scratchy throat in the back, runny nose, congestion, headache, muscle aches. What we're not seeing is a lot of cough, shortness of breath, and very little loss of taste and smell. So BA2 is presenting very similarly to what we saw in BA1, the original Omicron. Well, I think about 3 things as to how you'd approach it. Number one, what's going on in the community? Are you going to a place with a high level of circulating virus? One would say that many places in the US are in that cusp right now. Number 2, who are you and who do you live with? Are you at risk for getting seriously ill? So unvaccinated, over 65 and unboosted, or somebody who's immune compromised. And then number 3 is, are you at risk for even getting infected and your threshold for even getting infected is low and you can't even get that? And that is people like me who work in healthcare or students, because even 5 days away from school or from work means a big deal. So you may approach it very carefully in that way. So strategies, I think everyone knows, masks, if you're getting in a large indoor setting, they also include testing just like the past. And they include things like knowing how to access early therapy like Paxlovid. So these are all strategies, and ventilation, of course. So, just like the old days, if you're going to be in a risky setting with a risky group of severe disease, you may want to move it to outside, have an outdoor brunch. These are all things that you're doing. There's no magic formula. The more you do, the more risk you'll reduce. Yes, so even though it won't hopefully be disruptive to the hospital, it'll be disruptive to the community because we are isolating everyone who's positive for at least 5 days. And some people may be positive for longer than that.